In this video, we will use GIDEON to diagnose a Mongolian mystery bug. A 20-year-old man travels to the Far East following an army service. Starting in Thailand, he continues on to Mongolia. There, he suddenly becomes extremely ill, suffering from fever, cough with bloody sputum, and enlarged lymph nodes in his groin. He recalls that rats had entered his tent while he was camping. On admission to the hospital, he is found to have fever, pneumonia, and large lymph glands as described. There is no rash on his body. His white blood cell count is elevated, and there is no thrombocytopenia. The culture of his sputum and blood reveals a facultative gram-negative bacillus. Let's see if we can diagnose this disease using GIDEON Bayesian analysis-driven tools. We will use the probability engine method. First, let's add the location where the disease was acquired. For a more accurate differential diagnosis, it is helpful to factor in the incubation period. In the present case, it might be useful to know when the patient entered Mongolia, when he was in contact with rats, etc. So, let's say that the patient entered Mongolia on 1st of November and became ill 19 days later. Let's go ahead and add laboratory test results as well as clinical findings to this case. Both positive and negative findings are important in generating a strong differential, so add as many as you can. As clinical findings are added, the differential diagnosis list will rearrange itself and get shorter. Upon moving your mouse over any clinical findings, you may notice each one has a helpful text definition and an image. After you have entered the patient's clinical findings, the screen should look something like this. At this point, you have a number of options. You may download the case summary as a PDF or ask GIDEON why a given disease did not appear among the diagnoses by clicking on the Why Not button. For example, you may have felt that this patient is suffering from Lassa fever. Searching for Lassa fever will display the list of findings that are incompatible with this diagnosis. You may remove any of them from here and recalculate the list of likely diseases if desired. You may be interested in accessing a country note for the most likely disease. Simply click on the flag to do so. Let's go back to the probability engine and add the listed diseases to the comparison table, which contains further discriminative findings. The soldier has been diagnosed with plague, but thanks to medical advances, it is no longer as deadly as it used to be. Using GIDEON Anti-Infective Drugs database, the doctor is able to prescribe the most appropriate treatment, and our soldier goes back home good as new. We hope you found this video helpful, and thank you for watching.